I'm very excited to share that over the last week, the Society for Pediatric Dermatology, which has now reached over 1,200 members, had a strategic retreat to look at where we've been over the last 3 years and where we're going for the next 3 years. We accomplished approximately 70 goals that move us forward as a society for patient advocacy, specialty advocacy, workforce strengthening, research advancement, patient care, and education. And over the next 3 years, we have more goals to progress us forward in the areas of administration, education, research, workforce, and patient advocacy. So with regards to education, we want to not only educate patients and their families so that patients are empowered to get the best health care possible, but we want to educate the pipeline of trainees coming through medical school so that way they have exposure to pediatric dermatology and they can hopefully develop an interest in pediatric dermatology as a future career. We know that the pipeline for our specialty is imperative to sustain and grow pediatric dermatology in the future. The Society for Pediatric Dermatology is very young relative to other subspecialties within dermatology. The SPD was founded approximately 45 years ago. And we have started from a small subspecialty group into now a membership of 1,200 across the United States and also international members. Another thing we've done over the last few years in our society is develop a research arm called PEDRA, the Pediatric Dermatology Research Alliance. This now is a separate, full-functioning society and administrative body that works collaboratively with providers and institutions across the country who are interested in advocating for scientific research advancement for children and adolescents with skin disease. We have multiple projects that are currently ongoing across PEDRA to collaborate and study the advancement of skincare. The biggest project currently, which has approximately 45 to 50 institutions on board, is the Stigma of Skin Disease study. We're studying children and their families where the patient will have severe skin disease, and we're asking them how it affects their quality of life, their activities of daily living, and what they wish they could improve about having a chronic skin disease. Just as patients and the lay public think about the quality of life impact that things such as diabetes and seizures and food allergies have on a patient and their family, we want to make sure that we are educated and empower patients and the lay public to understand the quality of life burden and impact that a chronic skin disease has on a pediatric dermatology patient and their family. PEDRA has been raising money to distribute to providers and scientific researchers regarding pediatric skin disease, and they have been able to develop projects that involve vascular birthmarks, hemangiomas, quality of life, genetic dermatoses, and others.